Hey everyone, welcome to my channel. My name is Teresa. This is Path to Passing. Today we're going to talk about superficial versus deep veins, okay? So I wrote this pretty diagram and I put superficial in purple and your deep vein facts in pink. Go ahead and screenshot that if you need to. Perfect. So first, let's talk about your superficial veins. We're going to block out. We're not going to talk about deep yet. We're going to talk about superficial. So your superficial veins are solo travelers, okay? They travel alone. They're more visible to the skin surface. So think about your varicose veins, your spider veins, things like that are going to be your superficial vessels. And then they help control your body's temperature. They work with the skin. Your superficial veins is going to be what your nurses and doctors use to gain IV access, okay, for your PICC lines and your bypass grafts. A graft is just something where they take a superficial vein from a different part of the body and use it to help route blood flow in other parts of the body. So your bypass grafts. Examples of your superficial veins is going to be your greater saphenous vein and your small saphenous vein. Your greater saphenous vein sits in the most medial portion of your thigh and it runs from your saphenofemoral junction all the way down to your foot. Your small saphenous vein is going to be what you see from the posterior portion of your body or the behind portion of your body. And it's going to be in the popliteal region and it's going to go down the back of your calf. And I usually can see it the best around the ankle. Your upper extremity superficial veins are going to be your basilic and your cephalic. Your basilic is going to sit more in the inner portion of your arm, whereas the cephalic is going to sit on the outer portion. It comes with your subclavian, so it's going to be on the outer portion, okay? And the best place to find your cephalic vein, because I know it can be hard, is going to be in your antecubital fossa, and then you can go ahead and follow it up to the outside of your arm. So for superficial vessels, you're going to use high frequency probes, okay? Ultrasound techs, you're going to use high frequency cameras. This is going to be like your 615, your linear 615 if you have a GE machine. So let's go over to the deep veins and how do deep veins differ from your superficial. So your deep veins travel in pairs. They don't travel solo. So usually you're going to have an artery with a vein. So your femoral vein and your femoral artery, those are a paired set of a vein and artery that are deep. They are surrounded by muscle. They're a little bit more important than the superficial veins, honestly. If something happens to a deep vein, you're in big trouble. So they're surrounded by muscle. Your deep veins send 90% of its blood supply estimated back to the heart, okay? 90% of your venous return. Your deep veins have more valves to prevent backflow, okay? So when it comes to valves, in the deep veins, valves are like two doors, okay? And the doors open for the venous blood flow to go through it, and then they close because it doesn't want the venous flow to go backwards, okay? If the venous flow is going backwards, that's reflux and that's an incompetent valve and you have an issue, okay? Back to the chart. So examples of deep veins in your body for the lower extremities are going to be your femoral vein, your popliteal vein, your posterior tibial vein, and your perineal veins, okay? And in the upper extremities, it's going to be your subclavian vein, your brachial vein, your radial and ulnar, okay? Your subclavian vein runs with your clavicle, and then once it gets into the armpit region, which I like to look at the axillary vein in my armpit, so it goes subclavian, then axillary, and then it turns into your brachial, and then it splits into your radial, which goes with your thumb and your ulnar arteries. All right, so for deep veins, you're going to use a lower frequency camera. You're going to use your 2.9, and I'm going to put my face in this camera because we're going to talk about using a curvilinear 2.6. You need to be using all the tools in your toolbox. If you have a patient that is larger or has swelling edema, you need to be trying to use your curvilinear camera, especially when you're trying to see like the superficial. We're not gonna call it superficial. When you're trying to see the most superior aspect of your femoral vein as well as your mid-femoral vein, it's gonna be very helpful to use that curvilinear 2.6 camera. And then you can switch back to your 2.9 to be able to visualize your inferior or your distal portion of your femoral vein. So try to use, I think we should all try to use 2 cameras per study at least. And that's because you wanna make sure that you're optimizing each portion of your study based on that patient. And most times I've seen that my best quality images come from when I use more than one camera. So superficial versus deep, I hope you have a better understanding. Go ahead and like, comment, subscribe so that I can make more 5-minute video breakdowns for you.